It is very common during pregnancy to feel tired and want to sleep most of the time. This video will discuss why pregnant women often feel sleepy, and will also suggest ways to stay energetic and active throughout pregnancy. Tiredness is more common in the first trimester. If you haven't noticed any pregnancy symptoms yet, fatigue may gradually decrease in the second trimester, only to return in the last few months. However, every pregnancy is different. Fatigue during the first trimester is very common. You may feel exhausted in the early weeks, as your body works hard to support the baby growing inside your uterus. One reason is the increase in blood pressure. Even after 6 months, many women continue to experience tiredness. Sleeping difficulties are also very common during pregnancy. The first step you need to take is learning to relax. If you are a working woman, you can request your employer to reduce your workload. At home, don't hesitate to take help from your family members, whether nearby or abroad, for household chores. At the beginning of pregnancy, try to fix your schedule as much as possible. Pay close attention to your health and eat a balanced, nutritious diet. Reduce spicy foods and avoid eating them too often. Instead, include high-protein foods in your meals, as protein helps boost your energy levels. Alongside healthy eating, practice light exercises that improve blood circulation and help maintain healthy blood pressure. And don't forget to take your supplements regularly. You may have already heard that sleeping on your left-hand side is the best position during the second and third trimesters of pregnancy. A key goal is to maintain a neutral spine position with your shoulders and ribs stacked directly over your hips. Think of it as a seated or standing posture, gently tilted into a lying down position. Many pregnant women unintentionally twist while sleeping at night because of the growing weight of the belly. If your pregnancy pillow doesn't support your ankle, or if you're not pulling your knee up, your belly may drag downward. To avoid this twist, place a wedge, towel, or folded blanket underneath your belly. Then, grab your pregnancy pillow or stack up a few pillows for extra support. When you bring your knee up so everything stays aligned and your ankle isn't dropping down, it can help ease hip pain. On the other hand, if your knee flops down, the misalignment may lead to discomfort in the hip area. If you have a U-shaped pregnancy pillow, that can also be very helpful. This way, if you accidentally roll onto your back during sleep, you won't end up lying completely flat. The reason it's not recommended to lie flat on your back is that the weight of your uterus and baby can press against the inferior vena cava, the vein responsible for carrying blood from your lower body back to the placenta. Even if you're slightly tilted, the pressure won't crush that blood vessel, keeping both you and your baby safe. The left-hand side remains the best position for sleep during pregnancy. It reduces pressure on the inferior vena cava, ensuring maximum blood flow to the placenta. It also helps the kidneys function more efficiently, which supports waste removal and may reduce swelling in your feet and ankles. Of course, pregnancy can be uncomfortable, and it's not always easy to stay on one side all night. Flipping between your right and left sides is perfectly safe. Sleeping on your right-hand side is not harmful. If you're dealing with heartburn, try stacking extra pillows or using a wedge to slightly elevate your upper body. Gentle stretching before bed can also make it easier to fall asleep and stay comfortable through the night. Thanks for watching. Please don't stop here. Watch the next video and keep learning with us. Share and subscribe for more.